This is Health 54 right here on your digital first Pan-African News Network, TOS Television. I am Rose Aldo. A deadly disease fatal to rabbits in around 80% of cases is spreading across the United States, with new cases now confirmed in Florida. Rabbit hemorrhagic disease does not affect human health, but is highly infectious and frequently fatal to both wild and domestic rabbits, with a fatality rate of between 80% and 100%. The strain of rabbit hemorrhagic disease currently affecting the United States is known as RHDV2. This is a virus that affects rabbits over a 3 to 9 day incubation period. Symptoms in infected animals including lethargy, weight loss, and hemorrhages from various orifices such as the nose or eyes. It is spread by coming into direct contact with live or dead infected rabbits, or by contaminated surfaces such as their bedding. It can also be spread by rabbits orally and through skin trauma. Similarly, a dangerous skin fungus that spread easily, simply identified as BD, has been found in 2 California native salamander species. A team of scientists wrote in late November in an article in the journal Frontiers in Veterinary Medicine. The pathogen, which causes lesions, disrupted skin functions, lethargy, loss of appetite, and eventually death, is as fatal as it is hardy. A new study by Canadian researchers has shown that pregnant women who consume lots of artificial sweeteners could be more at risk of giving birth to children who end up being obese. The study, though carried out on rats, found that pregnant rats fed sativa or aptamine artificial sweeteners had pups that were fatter. The researchers who'd performed the experiment stated that their findings could be used to caution expectant mothers against consuming sweeteners, noting that other studies have found similar findings in humans. And the Federal Capital Territory Administration, FCTA, has announced that it would vaccinate 1.1 million children under the age of 5 in 2,837 communities across the FCT against poliovirus between January 22nd and 26. This was disclosed by the Mandate Secretary, Health and Human Services, Abubakar Tafida, at the first meeting of the FCT Task Force on the Polio Eradication Initiative and routine immunization. A new bill in the Illinois General Assembly proposes appropriating $4.5 million in COVID-19 emergency funds to fighting the HIV and AIDS epidemic. According to the text of the bill, for more than 4 decades, HIV and AIDS-5 has ravaged communities across America and Illinois. Dublin takes down on the racial health disparities also laid bare across the 7 opioid epidemic, maternal and infant mortality rates, COVID-19 AIDS mortality and morbidity rates, and the rising rate of 9 sexually transmitted infections. The bill proposes using these funds to expand access to PrEP testing and treatment for the virus. If passed, the bill would go into effect immediately and would help to fund assistance programs relating to AIDS and the Getting to Zero Illinois plan, a program with the goal of ending the transmission of the disease in the state by 2030. This is TOS Television Network, and you're watching Health 54. More stories, including Nigeria's COVID-19 update for January 21, 2022, when we return. Do stay tuned. Welcome back. South Africa is enhancing its capacity to identify and respond to emerging pathogens and deadly diseases after leading global efforts to identify new strains of the coronavirus. Having alerted the world to both the Beta and Omicron COVID-19 variants, the country has garnered international support to help it build new laboratories and capabilities and hire and train more African scientists to respond to future epidemic threats. Capacity is being added across a network of a dozen institutions, which could employ as many as 1,000 additional personnel. Also, studies have shown that more than 1.2 million people died worldwide in 2019 from infections caused by bacteria resistant to antibiotics. This is more than the annual death toll from malaria or AIDS. The overuse of antibiotics in recent years for trivial infections means they are becoming less effective against serious infections. Experts believe that people are dying from common, previously treatable infections because the bacteria that cause them have become resistant to treatment, and for urgent investment in new drugs and using current ones more wisely are recommended to protect against it. 3 health workers in Edo State, Nigeria, were infected with Lassa fever between January 10 and January 16, 2022, according to the epidemiological report obtained from the Nigeria Center for Disease Control. The center stated that while 102 deaths were reported between week 1 and week 52 in 2021, 11 deaths had been reported in the first 2 weeks of 2022, making a total of 113 deaths reported so far. Since the last outbreak of the disease in 2016, the NCDC noted that there had been an increase in the number of recurring cases. In 2019, the center noted that a total of 796 cases were reported, while in 2020, a total of 1,165 cases were confirmed during the height of the COVID-19 pandemic. Austria has moved closer to introducing a compulsory vaccination order after Parliament's lower house voted in favor of new government proposals. The law, which is due to come into effect on February 1, would make Austria the first European country to introduce a mandatory jab. From mid-March, the law will see adults unvaccinated against COVID-19 subjected to fines of up to £3.6. So far, 72% of Austrians have been fully vaccinated against the virus. And the Nigeria Center for Disease Control (NCDC) on Thursday recorded 6 additional deaths and 123 new infections from the coronavirus disease across 12 states of the Federation. The NCDC made this known on its Facebook page on Friday morning. The center noted that the death toll from the disease increased to 3,123 from 3,117, reported 24 hours earlier, when it recorded a single death, adding that the new confirmed cases have increased infection toll to 251,694, including currently active cases of 23,174. And that is Health 54 right here on your digital first Pan-African News Network, TOS Television. For more updates, visit www.tostvnetwork.com. Do follow and like TOS Television Network on Facebook, Twitter, and Instagram. And remember to subscribe on YouTube. Do stay with us and enjoy more programs on TOS Television Network. Remember, health is wealth. So till I come your way next time, do stay healthy. I am Rose Aldo, and many thanks for watching.